Africa media briefing, which is taking place in collaboration with the APO group. First, as always, we have some housekeeping. Remember, you can choose your language of preference by turning to the globe at the bottom of your Zoom application, at the bottom right, and selecting your language. Remember, you can also ask your questions. We shall answer your questions at the end of the after hearing from our panelists, and you can use the question and answer function also in the Zoom application. And don't forget that you will need to provide us with a name and the news organization that you represent.
Bonjour à tous et merci de vous être connectés pour ce briefing de WHO Afrique en collaboration avec APO Group. Donc, il va y avoir des adresses de tous les speakers et ensuite nous ouvrirons la session aux questions. Pour poser aux questions, merci d'utiliser l'outil de Q&A intégré à Zoom. Vous pouvez également choisir la langue dans laquelle vous voulez entendre la conférence grâce à l'outil d'interprétation de Zoom, le petit globe, et nous pouvons prendre vos questions live.
Merci beaucoup, François. And joining us from Brazzaville today, the Republic of Congo, is Dr. Mashidiso Moweti, the WHO Regional Director for Africa. And I'll now let Dr. Moweti introduce our other panelists.
So, good morning, good afternoon, bonjour, and welcome to all the journalists and colleagues participating in this press conference today. It's a great pleasure for me to be joined by Yvonne Chaka Chaka, the internationally renowned South African singer, humanitarian, philanthropist, health and rights advocate, and my dear sister as well, and by my colleague, Madam Oulimata Sarr, who is the Regional Director for UN Women in West and Central Africa, based in Dakar. As we look forward to celebrating International Women's Day next Monday, under the theme, Women in Leadership, Achieving an Equal Future in a COVID-19 World, we'll discuss how the COVID-19 pandemic has affected women in Africa. On the African continent, there have now been more than 3.9 million cases of COVID-19, and sadly, 104,000 people have died. Overall, the epidemic is still trending downwards in most countries on the continent after a second wave, but with pressures to ease restrictions, population fatigue in adhering to preventive measures, and the circulation of variants of concern, there is a real risk of cases increasing again in the future. In fact, we have seen an increasing trend in about 10 countries. Our analysis of 28 countries, but of distribution by sex, finds that on average, 41% of COVID-19 cases are women. Of course, this varies across countries. This lower burden among women is likely due to a range of factors, including the findings of several studies that women are more likely than men to adhere to measures to prevent COVID-19. Women have really stepped up to the challenge of this pandemic with courage and with compassion. They make up 70% of the global health workforce, and many women are on the front lines, especially as nurses and community health workers, and of course, primary caregivers in families at home. Women are showing impressive leadership in politics and in the private sector. Heads of state, such as the New Zealand Prime Minister, the Right Honorable Jacinda Ardern, other heads of state who are women like the leader of Iceland's, philanthropists like Toyin Saraki, trailblazers like Dr. Awa Kolsek, and innovators like Dr. Ola Brown have mobilized strongly against COVID-19 and other priority health issues. Unpaid care and domestic work, almost always done by women, has increased with school closures and stay-at-home orders, as have several risks. A WHO analysis conducted in 22 African countries found a rise in maternal deaths in 10 of them, while 9 reported a decline in births in health facilities and an increase in complications due to abortions. So COVID-19 is exacerbating inequities associated with gender in several key spheres of life and development. The work that many African women rely on for their livelihoods, for example, in areas such as personal care and in the informal sector, came to a standstill for several months in many countries due to the lockdowns. So at WHO, we are working with governments to ensure the continuous delivery of essential gender-responsive services, and we're providing training for health workers to support women suffering, for example, from gender-based violence, about which I'm sure we'll hear more from my fellow panelists. This is an area where work across sectors is crucial. Men and women and social and economic development will benefit from gender equality, and so we all need to invest in achieving it. Turning then to an update on access to vaccines, particularly through the COVAX facility. This week, Africa has been at the forefront of COVAX vaccine deliveries, finally, with almost 10 million vaccine doses being delivered to 11 countries as of this morning. We expect that around half of the African countries will receive COVAX deliveries in the coming week, and that most countries will have vaccination programs underway by the end of March. I'd like to appreciate His Excellency President Nana Akufo-Addo, the President of Ghana, for being among the first people in Ghana to get vaccinated, thus encouraging his fellow citizens to come forward when it's their turn, and for his strong support in debunking misinformation and reiterating the importance of all public health measures to defeat COVID-19. So I'd like to thank you very much once again for joining us, and I look forward to our discussion today.
Thank you very much, Dr. Moeti, for those beautiful words, and to again welcome to our distinguished guests today. Oulimata Sarr, could you please tell us how COVID-19 has impacted women and their livelihoods?
Thank you so much for giving me the opportunity, and thank you, Dr. Moeti, and our good friend Yvonne Shaka. You know, the United Nations called the COVID pandemic impact on women the shadow pandemic. And I will focus on the economic side. We did a study. We talked to 1,300 women-owned businesses. And when I say women-owned businesses, formal and informal, in all sector, agriculture, trade, tourism and hospitality, you name it. And the message is the same. We have lost the vast majority of our revenue. In those 30 countries, the women have said that the lockdowns, the restrictions of movement have affected their business greatly. Has affected their business greatly because they are really the most vulnerable. If you recall, several studies have shown that the gender financing gap is huge. In Africa, you know, the figures are into $50–60 billion worth of gender financing gap. And today, we, with the UNDP, have started since September something called the Global Gender Response Tracker. And we looked at 49 countries, what kind of measures do they have in response to the COVID-19 that are gender sensitive? And then we realized that the vast majority of stimulus packages, of responses, of recovery plans seems to very much focus on how to address issues of violence. 56% address the issues of violence in some form. 40% of that address issues of economic empowerment and economic justice. And then we realized that some of them are still gender blind. I think a lot of countries, when addressing the issues of socio-economic well-being of women, thought that the response was food distribution, was maybe some marginal cash transfers. And the women that we spoke to said, no, we are looking for capital. We are looking for patient capital to keep our businesses afloat. I think that's critical. Dr. Moeti mentioned earlier on the burden of care that the women are carrying right now. And you will know that a lot of African countries don't have an institutionalized way of social protection. And then women who are in the informal sector are falling through the cracks. I know several countries in my region that did give some stimulus checks, some stimulus packages. But if you look at the images on TV, those checks were given to very well organized business association and business groups, most of them dominated by women, by men, I'm sorry. So it's very critical for us when we're looking at building back better, that we address the gender financing gap, that we make sure that measures that the governments are putting in place are not gender blind. And it's our role as partners, as the UN, to make sure that we engender our work. Otherwise, the women will continue to fall behind and left behind.
Thank you very much. Thank you very much. Indeed, we are pleased to have people like you to talk to us today in the wake of March when we celebrate the International Women's Day. Thank you very much, Madame Sarr. And now we turn over to Yvonne Chaka, who we celebrate also as an immunization ambassador, to please shed some light on what you've observed as the impact of COVID on women, especially being in a country like South Africa.
Thank you to our capable MC, Dr. Fiona. Is it Fiona?
Fiona, it is.
Thank you very much. Thank you very much. I always want to get people's names correctly. Thank you very much, Dr. Moeti, for inviting me, to speak today. And greetings to our sister, Madame Olimata, to all the journalists and panelists who are here today, here listening. I'm actually very honored, to have this conversation ahead of the International Women's Day and speak about the pandemic's effect on women. This morning, I was talking to a dear friend and a sister, Sophie Mukwena from the SABC. We have lost one of our best journalists, a sister and a friend as well, Karima Brown. She died this morning because of COVID. So I really want to take just a minute to acknowledge the good work that this woman has done and say to her family, may her soul rest in peace. We have lost a champion. And just 1 minute silence for her, ladies and gentlemen. Thank you very much. It's not very easy. In the past, we've seen COVID-19 has turned our lives and our family lives, our professional lives upside down. I know that too well, and all I know is that our governments have implemented measures to control the pandemic. And while I see these, I see the talk about these things. We need to make sure that our women are not affected, but it's said that they are. The speakers before me have issues that women go through, and girls, the experiences that our children are going through as well. It's another thing that we have to look at. A girl child, we have to help now. I've listened to women share their personal experiences on how this pandemic has really affected them. I have a radio station called Woman Radio, and I hear women every day talking about these challenges. It is important that we stand for our rights, ladies and gentlemen. Women Radio is one of those platforms where topics which are considered to be taboo can finally be discussed, especially for women. Women can speak now and tell us what their problems are, and we have to be listening. But with that said, I still think we need to bring our men. Once we as women understand ourselves, empowered ourselves, know our issues, it will be very easy to have men to advocate for us. A station that pushes to the fore and be part of us and advocate for us. I know the pandemic has resulted in many school closures around Africa particularly, and girls are not going to school. And what does that do to them? These girls, they fall.
I think we're having an issue there.
Or because of the pandemic, a girl not going to school. Are you having, can you hear me?
We can hear you now. Kindly go ahead.
Okay, I was saying, can you imagine a girl who has not been going to school? It becomes very difficult for a girl child to go back to school. So what does that happen? What happens next? These young people fall prey to these terrible people. They fall prey to these men, and that results to unplanned pregnancies or sometimes exploitation. How do we make sure that doesn't happen? Gender-based violence is another thing. It has been a huge problem in Africa. I know only too well. When I was growing up as a young girl in Soweto, Dobsonville, I've seen women being raped. I've seen women being maimed. I've seen women being abused by those that are supposed to be protecting them, loving them, and guarding them. What is this world coming to? How are we going to change this pandemic? I would like to see our governments taking gender-based violence seriously as they are taking this pandemic called COVID. We need to start having actions. Plans are there, policies are being put by those who are in power. We need the political will, but at the end of the day, we need action. We need to make sure that our women are not abused. Women have lost their work. Women are the ones who make sure that even in this pandemic, our husband, our children, our partners have got food to eat. But what happens at the end of the day? They are the ones who fall prey to all the bad people and the bad things. Ladies and gentlemen, I think we need to start fighting even more, not taking arms, but making sure that our women are not in the situation that they are in. You can imagine a woman who has lost her job, or our people holistically. What does that do to your mental health? You then find so many people that their mental state is not correct because of this pandemic. So we need to make sure that we ask our governments to close all those gaps. We also need to have data. Once we have enough and sufficient data that tells us how many people have the pandemic, how many people have got help, that will then help us and actually guide us. Ladies and gentlemen, we can make this. We can and share their stories. The more the problems are discussed openly and understood, when we as the public, we as the community, we as government, we as with the powers that be are starting to work together. And as I close, I want to say, I absolutely have no desire or any wish to be anything else. I am a woman. I just want to remain a woman because I bring life into this earth. All I'm asking is to recognize my worth, because the future we can change and the world we should rearrange. I am a woman. Thank you.
Always exciting, and thank you for those very powerful words, Yvonne. I grew up with the nickname Yvonne Chaka Chaka because people thought I looked like you and danced a lot like you. So now that we've heard from our panelists, it's your turn, dear journalists, to ask your question, and please remember to use the Q&A function at the bottom of your screen, and we shall be able to answer your questions. Give us your name and give us the news agency that you represent. And Yvonne, just to let you know that Sophie from SABC has followed you. We shall have the first question from Sophie Mokoena. And SABC, please kindly go live with your question.
Thank you so much. I just want to check with Dr. Moeti. Dr. Moeti, when you look at the situation, particularly on the continent, 1 year on since South Africa reported the first COVID-19 case, the voice of a woman is not prominent in terms of solutions and suggestions on what needs to be done to address the pandemic, on issues of research, but also access to vaccine, the is still no information whether pregnant women can take the vaccine and all of that. What is the World Health Organization doing to support women who are in research and science to come up with solutions and also address the health challenges facing women in terms of also ensuring access to vaccine?
Okay.
Thank you, Sophie. Dr.
Okay.
Moeti,
Sure. Thank you very much, Sophie, for that that question, and condolences on the loss of your colleague that Yvonne told us about at the start of this press conference. First of all, talking about the health challenges of women and what WHO is doing, we work a lot as far as particularly healthcare workers, the majority of whom in our region are nurses. I am very much part of the movement around showcasing and highlighting the leadership, the contribution of women who are nurses in providing care at the primary level, right up to being part of the leaders in health in the public health systems in the African region. And a lot of the work that we do now in relation to, for example, infection prevention and control has been around training, enabling people, healthcare workers, particularly nurses, to protect themselves at the workplace, and ensuring that we highlight their contribution and see that is given its proper place in terms of their appreciation of the role and contribution of women to the response to the pandemic. With regard to pregnant women, WHO's guidelines indicate that there is no contraindication to pregnant women receiving the vaccine. So our advice is that pregnant women can be vaccinated against COVID-19. And then finally, in terms of research, yes, indeed, I think we have to acknowledge overall that financing for research is a challenge in African countries by African governments. Most of the research done is carried out in 4 or 5 countries and mainly financed internationally in the rest of the region. We have, as WHO, an advisory group, a senior level advisory group on research, on which there are some women members. And our work is to promote financing for research, promote collaboration between governments and researchers, mainly in academic institutions. And there we make an effort to identify women researchers to be engaged in research. I think you're correct that we could do better as we engender, as our sister, Madam Sa suggested, our work in WHO to particularly target women researchers. We made a lot of effort in WHO to target women workers, to bring in women into our organization. We're seeing some change there, and we will expand this work to cover our influence over policies in countries in terms of who gets selected, who gets funded, and make sure that women have a fair chance at that as well.
Thank you very much, Dr. Moeti. Madam Tsao, this is your area of work. I would like you to also weigh in into this. What is the UN Women doing to fill such a gap?
Thank you so much. I think, our gender agenda is about rights, representation, and resources. I say that because 2020, actually, when the COVID-19 pandemic started, it was really a highlight year, a very important year for us. For some of them, for some of the people who are online, you will remember that, 25 years ago, 45,000 women met in Beijing, China, and came out with a very platform of action called the Beijing Platform for Action. Hillary Clinton made a very famous speech, "Women's rights are human rights." And last year, we were celebrating the 25 years of the Beijing Platform for Action, showing that we had some gains in terms of primary school education, in terms of maternal mortality, but we have a long way to go. And I will start with representation. Apart from South Africa, Namibia, Rwanda, and Senegal, and other countries, very few countries in Africa have a parity in their parliament. So representation is extremely important for us, because where the decisions are being made that affect us who are half of the population, we are not represented. So making sure that women leadership, which is the theme of International Women's Day, is at the center of what we do. Representation at all levels, in the health, in education, in media, because we know that we are able to amplify our voices. That's number one. 2020 was also the 10 years of UN Women. As you know, UN Women was founded by civil society organization Strong Ask, and the Secretary General of the United Nations decided to make it an agency that is focused on gender equality and women empowerment, making sure that we move the needle on political representation, on ending violence against women. Because if you recall, on the 6th of April, the Secretary General made a call for a ceasefire on domestic violence, because we saw that during the pandemic, when restrictions of movement were implemented by a lot of countries, women were at the epicenter of the domestic violence, blocked with their partners who are in all countries, whether it was Europe or Africa. For once, we were able to find examples worldwide to demonstrate that the advocacy that we have been doing on ending gender-based violence is critical. And in the region that I cover, the Sahel, the studies show that during this period of school being closed, girls were being married. Harmful traditional practices such as female genital mutilation were happening. So we know that there's a shadow pandemic, as Pumzile, our ED, calls it, happening right now that we need to address. We also need to address the issue of economic empowerment. Women are tired of microfinance. We are tired of Stockfell. Women that we spoke to through our studies are saying, there's nothing micro about us. We are looking for patient capital, credit lines, guarantee funds that will really help us leapfrog. I'll end by talking about the workforce and the gender pay gap. Research also shows that it's going to take us 170 years to close the gender pay gap. We think it's unacceptable. And the message that UN Women is giving to the world is that the COVID-19 pandemic gives us an opportunity to build back better. And how do we build back better is that when we look at recovery, how do we make sure that that recovery is fair and brings about social justice?
Wow, very powerful. And indeed, every time a woman speaks, we can hear the passion with which it comes. And I would want to reassure you, Madam Sar and Yvonne Chaka, that Dr. Maweti in the African region is doing an excellent job in promoting women, especially in the health sector. And last year, 8th of March, launched an event and an initiative to recruit 100 UNVs into the World Health Organization African region. So this was such a big climb for us. So now, given the period that we are in, which still goes back to COVID and the COVID vaccine in this particular moment, we now have questions that are sticking out still for vaccines, and I'll mix these with women questions that we are still getting. So we have our first question from Voice of America, Columbus Mavunga. And the first question goes to you, Dr. Maweti. And is the WHO happy with the rate at which African countries are rolling out their COVID-19 vaccine programs? And the same journalist asks a question, which I'll give to you, Dr. Mihigo, who is our backup here today, to also help us answer some of these vaccine questions that says, given the fragility of most African countries, economies, will they be able to import adequate COVID-19 vaccines rather than just depend on donations? That's for you, Dr. Mihigo. The first one will go to Dr. Maweti.
Yes, thank you. Of course, we're very pleased, as I said in my statement, that finally African countries have started to receive supplies of vaccine. And as I said, we expect now that about 10 or so countries, 11 countries have received their vaccines in the last few days, and more will be doing so, including today in the next few weeks, that by the end of March, African countries will be starting their operations to roll out the vaccine. So that is a very positive step forward. It's something that has taken a lot of work, collaborative work in this multilateral platform called COVAX, which is coordinated by WHO, Gavi, and CEPI, and in which we have the partnership between countries at different levels of income and revenue, including many low and middle income countries, quite a few African countries, and some upper income countries that have contributed some financing to work together, pool resources, create a market, go looking together for vaccine supplies. Of course, we would like the situation to be slightly different than it is in terms of access to vaccines. So even if some money is there and this platform still has some gaps in the financing that is needed to actually reach the levels of coverage of vaccine that we are desiring, we would like the situation to be fairer in terms of access to vaccine supplies. And we are seeing that the targets and ambitions to cover whole populations still vary greatly between wealthy countries and low-income countries, many of whom are partners in the COVAX facility. But we are pleased that the work has started. Our job now is to work with partners to support the countries to make the best use of the vaccine supplies that they are getting, starting with the most vulnerable groups and starting also with healthcare workers. And we hope that the manufacturing capacity of the pharmaceutical companies that have developed vaccines will increase so that our ambition of reaching 20% can be seen to go higher as pharmaceutical companies invest much more in the production capacity and more vaccine supplies are available.
Okay, thank you. Over to you, Dr. Mihigo, with the fragility of our economies.
Okay, thank you, Dr. Tuebwe. Yeah, with this question, I think the COVAX facility itself, when it was set up, it was meant exactly to support mainly low-income countries to address the issue of equitable access to vaccines. So indeed, many countries are struggling to put forward resources or additional resources to get vaccine. And I believe this is what COVAX facility is trying to help. As you know, most of the vaccines that are currently being donated through the COVAX facility are free of charge. So when it comes to importing additional doses of vaccine, there are different avenues that a country could take, either to use the African Union platform, which also it's a pool kind of approach to get vaccine access. But we would like to very much country to discourage country to go on the bilateral deals perspective, because this is where it becomes very complicated. It becomes country getting very high price. So there is, even within the COVAX facility, a possibility to access vaccine beyond the 20% through the same costs that COVAX facility is getting its vaccine. So we will encourage country first to take advantage of the doses being provided through COVAX. Secondly, if they want to go beyond, to use the pooled mechanism that has been put in place, either through the African Union platform or to take that beyond their vaccine allocation within the COVAX facility.
Thanks, Dr. Mihigo. And I hope you realize that you're a special guest today as the man amidst women. So now I'll go to Sarah Jerving next from DEVEX. Kindly go live with your question.
Thanks for taking my question. Does WHO have a goal in terms of what percentage of positive COVID-19 samples that African countries should aspire to perform genomic sequencing on? And can you also comment on the impact of the COVID-19 pandemic on HPV screenings and cervical cancer cases?
Okay, thank you very much. I'll ask you, Dr. Ngoy, to respond to the first question on the genome sequencing, and if we have any updates on that and if we have a goal as WHO.
Thank you, Fiona. Please, can you repeat the question, please? I didn't get it.
Sarah, would you like to repeat your question?
Sure. So does WHO have a goal in terms of what percentage of positive COVID-19 samples that African countries should perform genomic sequencing on? Like, would it be 5% of positive samples, 10%? And kind of what, on average, what is the percentage that African nations are currently performing genomic sequencing?
No, thank you very much, and thank you for we don't have a target in terms of percentage of the sample that need to be sequenced on. This is just for the simple reason that sequencing is actually done in relation to surveillance. What I mean by surveillance is related to the pattern of the pandemic that we are seeing in a country. That's why we advise the country to do sequencing or not. Otherwise, what we call routine surveillance is only done for specific disease like influenza. But for the COVID-19, we are conducting, our aim is to be able to conduct sequencing in all countries because the genomic surveillance will help us to determine whether there are new variants in those countries or the new variant are circulating or the already known variant are circulating in other countries. But in terms of percentage of the sample that we have, that we need to reach, we don't have that kind of target, but we have the percentage out of the samples that need to be selected from a cluster of cases or a cluster of cases in a country, but not a target as such.
Thank you, Dr. Ngoi, our expert who is now managing the team that is leading the COVID response in the African region. There was a question on the impact of of the pandemic on HPV screening. Dr. Mihigo, would you want to quickly go over that?
Okay, thank you, Fiona. Let me first, on your last comment, acknowledge my participation in this powerful panel of women. I think this is really unique, and thanks to Dr. Moeti for bringing such a wonderful panel together. I think, Fiona, we don't have specific data on HPV screening, but in terms of overall following up the continuity of health services, clearly we are doing some regular assessment in the country to try to understand how preventive measure in particular being a routine vaccination, but also cervical cancer screening in terms of the broader NCD management are being done. And as we have seen in the first part of the pandemic, most of these preventive services were quite affected. But to which extent and the scale of reduction, I think we will probably need to collect additional data to try to understand the extent to which these services were affected. But we've just finalized a study on oral health services, where we have seen that from the first part of the year during the pandemic compared to the second part of the year, and that was before the second wave, though the services were quite much affected in the first part, we saw a slight recovery during the second part. We have now yet to analyze this type of trend, particularly with a screening for cervical cancer related to that. So I think this is well noted. We will definitely see how to gather such data related to health women.
Thank you very much, Dr. Mihigo. We have our next question going to you, Madam Sar, from UN Women, and it's from Naftali Mwaura from Shinwa. And the question is, briefly describe the impact of COVID-19 on African women, given the fact that these have historically been marginalized in terms of access to healthcare and income generation. And then we shall have another one still from Naftali, and this goes to you, Yvonne. Do you think the pandemic has worsened gender disparity in the continent? Over to you, Madam Sarah.
Yes, thank you so much for that. Yes, my answer is yes. The women are at the epicenter of the pandemic. And I want journalists to leave this conversation knowing that the COVID-19 pandemic is not gender neutral. Whether you're talking about the health sector, Dr. Moeti has mentioned, where 70% of the health workers and the support staff is essentially women. It shows you that in 2020, when they were saying woman of the year, the poster child or the poster picture of that was women. You will also recall that our economies have a large component, some say 60% of the informal sector, in Africa, and that informal sector is dominated by women. So you can imagine the drastic consequences and the impact on their revenue, which they go and find daily on the markets, have been affected by the COVID. But I also want to highlight, maybe now that I have the floor, that the women were also part of the solution, and I'll share a few examples from my region. In Nigeria, some women who were seamstresses saw that there was a gap on the market in terms of masks. Everybody was competing for masks. If you remember, even some airplanes with masks were hijacked in Europe, sold to the highest bidder. And I think a lot of economies and a lot of women reinvented themselves and started doing reusable masks. And there's actually quite an interesting report from BBC on Africa on a designer called Folake. Her brand is called Tiffany Amber, and she was able to turn around her manufacturing business and start doing protective equipment and masks for hospitals, for hospital workers, bed sheets, you name it. So women are very resilient and they were able to reinvent themselves. The second example I want to share on economic empowerment happened where we realized in Senegal that the food distribution, which also happened in many countries in Africa, the products that were being distributed were mostly imported, whether it was rice, whether it was sugar, and things like that. And I think one of the initiatives that I felt was very powerful and was replicated in other countries was how do we make sure that those food items that were being distributed were procured from women-owned businesses. So we should take the pandemic as an opportunity to do what we call women affirmative procurement. How do we make sure that the rice that is being distributed is bought from women farmers and women cooperatives, whether it's local cereals, so that really this new trend of what we call the local sovereignty in drugs, in food, in everything else, be really catalytic in bringing about women economic empowerment in Africa. I think we have a huge opportunity that we need to grab. I think there's definitely a gap, and that's our role, all of us as partners, to link up, to influence, government. Part of our work is how do we use data, statistics, so government can have what we call gender responsive budgeting, and they are able to tell us for every dollar that they spend, this is how much they spend on women and girls.
Excellent, excellent. And to you now, Yvonne, on if you think the pandemic has worsened the gender disparity in the region.
Thank you, Fiona. I really think it really has. We've seen women and girls, becoming extremely, becoming victims, because of the spike of the domestic violence that is there. And most of the people, more and more people are being pushed to poverty because of the pandemic. So women are really suffering, and girls, because of this. I mean, my two colleagues, Dr. Moeti and Madame Olimata, they've spoken about the gender equality that needs to be there. But women are the ones who are suffering most, and girls. But we know that the pandemic, COVID-19, it kills men and women. but women are the ones who suffer the most because they've always been disenfranchised and segregated. And now with the pandemic, that really shows. And we see more of these women being stuck at home with those that are supposed to be protecting them and giving them the money, and they get abused. So this really has become something that is a real pandemic, and we have to really take one step further and make sure that we nip it in the bud.
Excellent. Thank you very much. And so now we go to you, Lisa Schleng from Reuters, from Voice of America. Kindly go ahead with your question. Lisa, please go live with your question.
Okay, I'm unmuted now. Thank you very much. Dr. Moiti, panelists, good morning. I have a couple of questions. The first is, I wonder whether an analysis has been done, whether there are any sort of statistics regarding how women are disadvantaged by the COVID-19 pandemic in terms of illnesses and deaths, whether women are more vulnerable to the disease itself. Also, in terms of the kind of care that women get versus that of men, and the employment situation has been discussed to a sense. But I'm also wondering whether, because of the lockdowns, whether women are pushed into so-called negative coping mechanisms, forced to do sexual work, prostitution, and so forth. And then a quick question on vaccinations distributions. I was wondering whether there is any kind of a pecking order in terms of which countries get the vaccines first, whether they, and how the quantity is also distributed. I'm not clear on whether countries have to pay a certain amount of money for the vaccines or not. And how long do you think it will take for a significant part of the population on the continent to be vaccinated, given the amount of time it's taking for the vaccines to arrive? Thank you.
Wow, that's quite packaged. And I'll ask Dr. Moiti to share these questions with Madame Sarr.
Mm-hmm. Okay. So first of all, the impact on women, and in terms of access to health services, of course, there has been an observed impact on women. We do have some data, but not very comprehensive data on what has happened in terms of gaps in services, drops in levels of coverage and access compared to pre-COVID COVID times. So for example, we have data from Ethiopia showing that there's been something like a 10% reduction in sexual and reproductive health services, and that this could result in, now if you're projecting, quite a large number of women, about 48 million women with unmet needs for modern contraception, and more than 15 million additional unintended pregnancies. Early on in the pandemic, we observed in Zimbabwe, for example, that there had been something like a 70%, if I recall the figure, reduction in access to contraceptions in the first quarter of the year compared to the year before for women. So again, this will lead to unplanned pregnancies and other problems. In addition to that, as part of the disruption in health services, there was a 42% drop in cesarean sections in Zimbabwe between January and April last year compared to the same period in 2020. And there's been also a reduction in women delivering in healthcare facilities with a skilled midwife or a skilled assistant for the delivery. So there certainly have been reductions in access to critical services, particularly, I mean, for all people, let's be fair, but particularly as far as especially sexual and reproductive health services, which are vital for women, that has been a problem, which means, if I can now speak about building back better, that when we are designing or improving what we call the resilience of health services going into the future, this type of learning, observation needs to be taken into account in terms of what you plan into your service when there is an emergency. So it's not only to plan for ensuring that you can deliver immunization services for children, which is vitally important, but you bring in this gender lens. You look at those people who are able to pay for services, because in some of our countries, we don't have health insurance, and the people who are then worst affected are women, and you make sure that you take particular care around sexual and reproductive health services, young women's access to services, to ensure that we keep that in mind in terms of equity, considering the particular vulnerability of women, and making sure that it's planned in, it's anticipated, it is funded, and therefore the services can be delivered. The question about the pecking order of the delivery or access to vaccines, the COVAX facility's very strong and central principle is around equity. So it is designed in such a way that countries are provided with vaccine supplies so that they cover the same proportions of their population, in some senses sharing the challenge of the shortages of vaccines. So this is what is being done now. Countries, in terms of allocations, the COVAX facility ensures that what is available is distributed and divided up among countries, so that if it's, because the initial deliveries now were aimed at covering 3%, they are going to be covering something like 2.6%, and it has been calculated to ensure that all countries are able to cover the same proportion of their population at the same time with successive rounds. So again, emphasizing very strongly that principle of equity. How long is it going to be for significant proportions of African populations to be covered? At least the target, as far as the COVAX facility is concerned, is to have covered 3% of the population at the beginning, and to cover 20% of the population by the end of this year. We are very pleased that the African Union, working through its vaccine acquisition task team, has targeted ensuring that by the end of the year, sufficient vaccine has been procured and availed to countries to cover 60% of the population. As I said before, the COVAX targets were based on certain assumptions about manufacturing capacities and availability of financing to the facility. So it is a beginning in terms of the 20% that is targeted. Our hope and expectation from the discussions ongoing is that there is a lot of work going to try to expand the capacity to manufacture. The COVAX facility will be looking at adding to the resources that are available so that we reach a level of coverage in African countries that can not only reduce severe illness and deaths, but also start to have an impact on slowing down the spread of the pandemic, the so-called herd immunity.
Oh, yes, thank you. So, Madame Sarr, I'll ask you to weigh in.
Yes, we all agree that if we want to move the needle, if we want policymakers to take us seriously and influence, the policies that are being implemented, we need information. The journalists that are looking for information, I will recommend to visit two that you can find on Google, actually, two platforms. One is called the COVID-19 Global Gender Tracker that was implemented by UN Women and UNDP. If you Google it, you will find it. And it looks at 46 countries on the continent and the number of measures that have been put in place to respond to COVID. And we look at the nexus between, violence, economic issues, and unpaid care with all the list of countries, with the measures that they've taken, and some that are gender sensitive. Very, very important tool, even for you as a journalist, if you're looking for up-to-date data that you want to put, it's available in there. And you will see that 56% of all the measures have to do with ending violence against women, whether it's issues of policy, of skills, of services, of allocating additional finance. The second issue you will see that is highlighted on the tracker has to do with economic issues that I spoke to about earlier on. What are the measures that have been taken on the continent to address issues of economic empowerment, of social protection? You will find it there. Very few countries had issues to do with unpaid care work, with implementing some kind of high-level policy on working from home and getting remuneration. You will also find that I like to highlight Togo, which is the country that gave a slightly larger amount to women, allocated amount to women than men, because for them, the body of research shows that women spend, most of the money on the family. So they wanted to make a preferential treatment there. That's number one. The second study I will encourage all of you to go and look at, it's called Impact Her. If you type Impact Her, UN Women, African Development Bank, it will show you really what are the women entrepreneurs saying. And when I talk about women entrepreneur, I'm really talking about the broad range of entrepreneurship, formalized, informal, rural cooperatives, single person entrepreneurship. And the context that they gave us, the analysis that they provided, and at the end of that, what we feel is policies that governments need to put in place to move the needle. I think those are two important areas of of research and studies that can really inform some of the work that you do as journalists. Maybe to highlight, if I have to end with three areas where I think that we need to work harder on. I think Yvonne mentioned it is the area of positive masculinity and what we call at UN Women our he for she. Women of the world have been UN Women. We are convinced that to be able to bring about change, if we want to leapfrog into the future, we need to enroll the men. And those men, we call them our he for she. Those are really our champions who might be on decision-making tables where we are not, and who will take full responsibility to a fair and just world, a world that gives equal opportunity to men and boys and girls and women. That's number one. The second thing that I think is extremely important, and it's really cross-cutting issues, is statistics and data. We as women want to go beyond the anecdotes, just a few things I heard, I know, we have a feeling of, we want the numbers, because I think the numbers will demonstrate the huge gap there is in terms of revenue, in terms of rights, and in terms of representation. And lastly, technology. I think the COVID-19 shows us very quickly, particularly on the continent, that there is a digital divide. We know for a fact that some people stayed in school and some people did not have access to technology to continue being in school. And if you take the poster child of the person who did not go to school due to lack of technology, you will find a young African girl. And therefore, all our gains, since Beijing +25, we are going to be lost if we don't take technology as an enabler, as a catalytic instrument, calling upon government, mobile companies, any technology provider to really, as part of their corporate social responsibility, as part of policymaker, to make sure that there's free access to data, to internet, to technology, so we don't leave a huge majority of girls behind.
Wow, very powerful indeed. I know we are right at the tail end of this media briefing, but we'll have one sticky question, and this will go to you, Dr. Mihigo, and I will ask you to also make it really brief. This is a question from Omar Mohammed at Reuters, and the question is about the fact that they've seen richer countries like the UK reach out to the Serum Institute of India for the AstraZeneca vaccine, and what this impact will be on Africa securing the most needed vaccines.
Well, thank you, Fiona. I think the short answer will be that the forecast for vaccine provision through COVAX is on track. We hope that this will not be disrupted by any other external agreement. But what we can say at this stage from the information that we have is that the doses that has been negotiated through the COVAX have been confirmed, and we are starting to see the deployment of this vaccine in the region.
Great. So our doses are secured, and we should not worry that doses are coming from the COVAX facility. So thank you very much. I know we've really had an excellent discussion. Would have gone on and on and on because women do really know how to speak very well. So as we wind up, I'll give our panelists a minute each to give us their parting shot, and I'll start with you, my hero, Yvonne Chaka.
Well, thank you very much, Fiona. And I want to thank everybody for this great panel. I'm glad that all my friends have spoken about data, statistics, and all the technical information. But I think we really need to level the playing field. And secondly, I think we need to strengthen our health systems. That is very, very, very important. And thirdly, we need to make sure that we finance domestically, you know, because if people give you money from outside, they will tell you how to use it. And lastly, with this pandemic, we've seen a lot happening, particularly for women and girls. All I want to say is we need gender equalization. If we can do that, we would have done our best. And today it's Mama Miriam Makeba's birthday. She's my hero. She would have been 89 today. And I want to say to her, you fought for us, you've walked this road before, and we are still fighting. So it never ends. Merci beaucoup. But we as Africans, on feu, est-ce que l'Afrique peut changer davantage?
Oh, merci beaucoup. Then now over to you, Madame Oulimata Sarr.
Thank you so much. It was really a pleasure for me to be here. Thank you, Dr. Moeti and your team for inviting me. My parting words is just maybe a call for action. As you know, on Monday, it's International Women's Day. So we really want to occupy the space. I think it's a day where we amplify our voices. A lot of people say, well, it's a Women's Day every day. Well, we want to make sure that the 8th of March is remembered. The theme this year, as you know, is women's leadership in a COVID-19 world, where we are going to highlight things that we've done very well and things that we still need to push for. And it's a call for action for the youth, because, you know, we are a continent with young people. You know, some people say the average age is 19. And I think if we need the activists, we need those young people to know that, you know, you were born voting, so you never fought for the right to vote. But today in a COVID-19 world, as we're talking about building back better, they have a huge role to play because we want a just, a fair and equal world for them. Thank you.
Great, great. And now to you, Dr. Moeti.
Yes, thank you. So first I'd like to really thank my fellow panelists for a fabulous contribution to our conversation today, and thank the journalists for having joined us. And to end up with, I will just touch on a theme looking forward. Of course, we have a lot of work to do in the next month, a year or so, to put the vaccines that are arriving in countries into people's arms, making sure that happens, starting with healthcare workers, many of whom are women, and other people as well. When we start, and we are starting already to think about building back better, as I said before, we need, if we're really going to cover the gaps as far as gender is concerned and health, to design our services in a people-centered way and taking into account inequity and gender-driven inequity as well in the design of policies for financing health, for designing our systems for health insurance, for making sure that the approaches to improving access to services take into account all people. You know, when I was a young mom, I've got two daughters who are in their 30s. I was always very concerned about my kids as young African women. So how to support, help transition that 9-year-old girl who is jumping around playing so that she transitions through her adolescence into a confident woman who finds her space in our lives, in our economies, in being able to earn herself a decent living and contributes fabulously the way that women can to the development of our countries, because the inequities are actually a gap and an underutilization of the capacity, the talents, the innovation of women. So I would like to just join Ulimata in emphasizing that our policies, our strategies need to take gender into account in the same way as we write them, taking equity into account, because it's such a strong driver of gender. And then we will benefit from the capacity of women and leapfrog all aspects of our development into the future. And then finally, to end by saying, we have reached the point now where vaccines are becoming available. Again, we'd like to encourage everybody, when your turn comes, when your opportunity comes, please go and get the vaccine. That can be your personal contribution to solving the problem of the pandemic. In the meantime, please let's continue with our prevention measures, using our masks, keeping our distance, and practicing the hygiene practices, washing your hands, using sanitizers, because that needs to accompany for quite a few months, for a year at least, the rolling out of the vaccine in order for us to get over this situation. Thank you very much.
Thank you very much, Dr. Maweti. And indeed, as the disease was gender neutral, the vaccine will also be gender neutral. Thank you very much once again, our distinguished guests, an excellent panel in March, our special edition for the Women's Day. We were glad to have you. And to our journalists, just to let you know that Dr. Mihigo will stay back for just a few minutes to answer your sticking questions on the COVID-19 vaccine. Thank you very much and a pleasant day to you all.
Thank you. Thank you, Fiona.